Welcome back to the No Shame OBGYN Podcast with Fran and Dan.
Dan and Fran.
All right, so today's episode is going to be the anatomy class that you should have had that nobody had. And we have some guests with us today. We have Bella, our cervix, uterus, tubes, and ovaries. And we have Tori, who is
that's her name.
A clitoris.
Oh no.
Urethra, vagina, and we'll talk about all
I
the
did not
fun.
know that was the plan.
Yeah, well, I like to keep things fun.
Sure.
So listen, do you remember your high school health class?
I remember one slide from my high school health class,
yeah.
which scared me from having sex for like
That was the point, I
3
think.
days.
3 days. Nice.
Didn't work as well.
Nice.
Yeah.
Well, mine, I learned, where did you learn about sex or anatomy or any of that stuff?
High school health, and that's it.
Your family never talked to you about this
Never.
stuff? Okay.
Never. Like, I know, like, we talked about, like, the family stuff separately, about, like, you had it easy on the table, like, had
Yeah.
the discussion.
Yeah.
Like I said, my dad said, don't get anyone pregnant, and God forbid I even spoke to my mother.
Okay.
Like,
all right.
no.
So I feel like, actually, unfortunately, that's like the more common thing. Like, I remember learning a lot of anatomy from like Cosmo and like Teen Vogue and stuff. And then health class in elementary school.
Other than like the stupid guys looking at,
Right. Well, we'll talk about that. Porn. Like guys, I feel like guys learn a lot of anatomy. And then also women do too. But
fake anatomy.
fake anatomy. So
Not realistic anatomy.
Correct. So here we're going to talk about real shit. So this is the popular girl in high school. Right? Dan has got the uterus, cervix.
Uterus, cervix, fallopian tube, and ovaries.
Right. And everyone's heard about this girl because she makes the babies, causes you cramps, ruins your vacations, the whole shebang, But no one talks about the rest of your anatomy, right? And specifically the stuff that's outside of your body going into your body. So
Correct.
This is what we're going to cover today. This is the real silent legend. The silent legend.
Doesn't have to be so silent.
I hope it's not so silent. This girl right here, she's no drama. She don't make babies. She doesn't really do anything except make you happy.
She drives the emotion.
She makes you happy, right? So before we get into why she makes you so happy, we'll get into really what's down there to begin with.
Right. And just to orient everybody, I think it's important. Like, this is the outside, this is the inside. But if Fran stands up,
Yes, doctor.
if we're looking at Fran, it's like
Beep, beep.
and like this, right? So when we look at this, we're gonna Fran sits down, and we're gonna just so that way you know the direction of what we're looking at. So therefore you understand somewhat conceptually. We know there's a plush toy.
Right.
What the hell is going on?
Right. Okay, so let's start with the outside and then kind of make our way in, right? All right, so, and I encourage every single vagina-owning person to do this. Get a nice little camera or a mirror or something and put it on the floor after you watch this whole podcast. Stand over it, and that'll give you a really good way to kind of see what we're talking about up close and personal on your anatomy, okay?
And then once you do that, I have a lot of people, and this is a big talk in our world, where they're like, is this normal? Does this look normal? There's no one vagina, vulva that fits all. A lot of it's just normal.
Yeah.
So it's when you're gonna see online, you might see the perfect vagina. That's all bullshit.
No, it's not even perfect.
It's
Actually, what it is it's edited casting.
Yeah.
I read about this.
Oh, is it really?
Yeah,
I didn't
so
know
for
about that.
porn, because that's what Dr. Dan's alluding to, where you see a lot of gratuitous genitals, right, is porn. But they cast on purpose for what the perceived
Norm. Whatever.
perfection
That's
looks
fair.
like. So you're not going to see someone who has, let's say, asymmetrical labia where
Right.
one's bigger than the other, or a perineum that is darker, because that's not what they want, right? They want you to see what they think you want.
And also, a lot of the stuff that we know of is always investigated and researched on white women, but
Right.
all the conditions that we have for Black women has only recently started to have that full conversation on, and that makes us poorly trained physicians because we can't fully differentiate some conditions for Black women better than white women or brown women or green, yellow, blue, orange, yellow.
Right.
So
The point is that a lot of the stuff that you see that's mainstream, even something so stupid like Band-Aids, that fucking blew my mind. A Band-Aid. So
A Band-Aid. Like
What color is a Band-Aid?
Brown.
What? A Band-Aid's brown?
Yeah, it's like tannish brown.
Okay, see, that's great that you said that because I said it was nude, right?
Oh,
Band-Aid's
okay.
nude.
Fine. Yeah, I guess.
But it's not nude for everyone. It's nude for me.
Oh, okay, fine.
Right?
Fine,
Sorry,
fine.
I'm hitting the mic here. Excuse that. Anywho, well, we're getting off topic.
Yeah,
All
right. Let's
back
focus
to the clitoris.
anatomy.
Whee! Okay. So, anywho, when you stand over this mirror, what you're going to notice is you have vulva, right?
That's
Those
probably
are-
all you're gonna see though,
right.
too.
Most of the time.
Right.
Yeah. So now you have labia majora, and those are what are commonly, colloquially referred to as your lips, which is, we all kind of like cringe at that statement, but it is what it is. We're going to talk
Right.
we're going to flip between speaking in a medical
We don't
term,
cringe.
and then
No
we're going
shame.
to talk just like
Is what it
regular,
is.
right?
Yep.
So you have your labia, and so that's kind of like the hamburger bun, but
I didn't say that.
everyone's buns look different, right? So you totally can have some that have the labia minora or the internal labia that are like sticking out, or everything's kind of tucked. All the shit's normal.
And also where you are in your journey through life, right?
Yeah.
Whether you haven't gotten your period yet, which hopefully those girls aren't watching this podcast.
Well,
but
they
then,
should.
for YouTube purposes, whatever. But then also like perimenopausal, postmenopausal years looks completely different than what it is in your 20s and maybe
Yeah.
30s and 40s.
Yeah.
After deliveries, before deliveries. So
Yeah.
there's
When
a
you're
lot
pregnant and they get super
Right.
dark and you're like, holy shit.
or right after delivery where nothing looks,
Oof, where
So,
it's all swollen and
lot of
angry and
variation.
bruised.
a lot of variation. Yeah.
But yes, the point is that what you've got between your legs is normal.
Yeah.
So just love her.
And if you don't know, ask a professional.
Yeah. So, all right. So if you were to spread your labia apart and spread them well, right? Now, this is actually not labia, what we're looking at on my friend here. This is actually the top of the clitoris, which if you were to spread your labia and you look all the way to the top where the first indent in your body is your clitoris, right? And that is just the tip is peeking out. Actually, it's this whole piece and it tucks inside your body.
You'll
right?
never see it.
You'll never ever see it, right?
And that clitoris is the most nerve ending part of your body.
Over 8,000 nerve endings in this one little bolt.
And that's twice as much as the penis.
Right. Which makes you wonder why they finish first.
Because we're stupid.
Well, it's because a lot of women, I don't think, realize how to get their pleasure because they've been taught about just anatomy
And
in
I'm
the sense
sure
of
99.999% of men don't know how to get to that.
yeah, well, hopefully they're watching this and we can teach them.
Correct.
That's the whole point.
That's what we're here for.
Or you will learn and then you can direct him. It's like MapQuest, right? You print out the directions and you tell the guy, like, hey, you're like kind of off.
We're just
going
gonna
to
show you where
you
it
need to
is.
kind of come back up north, right? Go back to the 95, take it up a couple miles. Okay, cool.
Okay.
So another thing I hear a lot and always makes me like a little sad, low-key sad, because you own these parts, you should know what they are,
Okay.
is the urethra. So there are actually 3 orifices, aka holes.
A woman has 3 holes.
You have 3. 1, 2, and then back here is number 3, right? So
Yes. Yeah.
it's just not pictured
We're
here,
not,
right?
yeah.
So this one is where your urine comes out of. This whole orifice, right, same word, travels to your bladder and empties your urine, right? This guy is the vagina. We use the word vagina. People talk about your vagina and they like
They
just
think this.
they just like shove in this direction,
but it's in here.
Yeah, it's
like
inside your body.
Like this is the hole, so back here.
yeah. So this is actually technically called an introitus, which means it's like the doorway to your vagina.
Mm-hmm.
And then the third one is the rectum, right? The anus, actually, rather, not the anus is in the back. And in between, you have this little highway called the perineum. And it's kind of like this highway that connects like the playground to the sewage plant.
Do you just come up with this? Like you just come. Okay.
I just make this up on
Okay.
the fly, right out of my asshole. Ba-dum-bum. So yes, so that's what you're looking at. So
Yes.
now, Sex 101 for my friendies out there, most women will not have orgasms from penetrative sex, like in this vagina, beep, 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 beep. They might, because remember, this part's in your body. And so this part of your clitoris is getting rubbed a little bit, but most of you will find that the most enjoyable experience will be if homegirl is getting rubbed or massaged or something is happening to her
Stimulated.
during the penetration, because now the whole clitoris, the whole body is getting stimulated. right? So, all right, so that's what we're looking at, and you should know those things. You should know where they belong, and then also know what you like, and that takes some practice.
And bringing back to the anatomy stuff, when you come to the office for your regular exam, we are seeing all this stuff. And some people might ask, like, well, what's the point, right? So, for example, how often should I get an exam, or a female get an exam?
What kind of exam are you talking about?
Just like a vaginal vulvar exam.
Oh, okay,
right?
yeah.
And so a lot of the times, I'm going to put in the context of, like, let's say postmenopause, perimenopause, and let's say they're getting their PAPs every 3 to 5 years. They're like, well, why do I have to come every year if I'm getting my PAP every 3 to 5 years? Your PAP is off your cervix, so this has nothing to do with the cervix is back here, back here, right? So, but the reason why we do so is because this stuff can still develop cancer. This is surrounded by skin. You have melanomas, squamous cell carcinomas. You have cancer that happens here. And we have to look at those things. When I was a resident, had a patient who had cancer on her clitoris.
Oh, Jesus Christ.
And
whose dog did she kick in a past life?
It's tough, but we
God.
had to see where the cancer metastasized to. And do you know what I had to do, which was the worst fucking experience of my
Did you
life?
have to biopsy her clitoris?
I had to inject her clitoris
Oh.
with a radioactive chemical.
Oh.
So therefore, we knew where it spread into her nodes and see where the cancer traveled.
Did she lose her clitoris?
Well, she lost everything. But, like,
Did she die?
no,
Oh.
I don't know. I don't know. But because the primary site was here, this is the most sensitive part of your body. No matter how much lidocaine or whatever you give,
Put me to sleep.
I agreed.
Just take me off the earth.
But that was done at a radioactive, like with the radiation oncology area where they didn't have the anesthesia part there. It was horrendous. It was traumatic, but like it needed to be done. And I understand cancer is cancer, but this is why we look at these things. And you could have cancers here. You could have cancers here on the labia. So that's why we do those exams, because a year of melanoma and it's sitting around is a lot of freaking time.
Yeah.
And majority of the time there's other stuff that are more benign things like lichen sclerosis, lichen simplex chronic. These are fancy words of like the postmenopause disease in a sense. But lichen sclerosis has the potential of becoming squamous cell carcinoma, which is a cancer of the vulva. So even though this is more postmenopausal things, this is why you keep coming in for those exams. Now, for the 21-year-old or the younger patients, like the most common or like the thing that we see a lot in the emergency room, do you know?
Herpes?
Herpes, absolutely. Herpes. I was going at something else. Bartholin's.
Oh, yeah. Okay, so those are not on here, really.
They're not on there.
So, okay, so a Bartholin's gland, go for it.
Yeah, so that definitely helps with like the lubrication, especially for intercourse, things like that.
Where is it located, though?
But it's, this is a small vagina, let's just say, like the whole entrance, the introit is here, but it's usually at these corners. Let's say this is 6 o'clock, so let's say like between 7 to 8 on this side and between 4 and 5 on this side. And a lot of the time it becomes just like a big cyst. Like imagine like an ingrown hair that is massive,
I have seen a
red,
few.
super painful.
Poor thing, it really hurts like a bitch.
Yeah, and it's nothing that you did wrong. It's just sometimes it's just like a duct that gets clogged up.
Like a bad pimple.
Right, and it gets
pimple.
stuck. And the thing is, you usually end up going to the emergency room, and you probably have to get it popped. There's times you could try to like sitz baths and whatnot, but that's a common vulvar vaginal issue of like the younger years. The one even younger, right? Because this is like a lot of cultural things, right? Like when you have sex for the first time. Like what do we talk about? Like popping the cherry or all that stupid shit.
Right, where the hymen rips.
Right, and it could rip for any reason. You could be been on a bike. You could have had some trauma. Like that.
I was horseback riding.
Oh really?
Yeah.
And that's how.
Yep. You're gonna. Sorry, Dad. Sorry, Mom. I went horseback riding. I was like 12 years old, I think, 13, and we were cantering, and it was a lot of popping on the saddle, and I felt like a sharp pain, and I was like, what was that?
Right.
That hurt, and I knew it was in a weird area, so I didn't say anything, and I went inside, and I went to go wipe, and there was blood, and I was like, oh, what the hell, and I just kept it to myself until now.
Now we know.
I know.
The other crazy story I have is I had a girl that was 14 years old that presented to the emergency room when I was a resident. and she came in. She's like saying, every month I have severe abdominal pain.
Oh, I know where this is going.
But it's not. You'll see. I'm going to
Really?
shock you with this too.
Shock me. Shock a girl.
And I'll tell you what you're thinking, which is true, right? Whatever. So she's like, I have cyclic, meaning monthly abdominal pain, and it's rough. I'm like, you're 14. So I'm asking her questions, medical, surgical, blah, blah, all the history. And I'm like, well, have you had your period yet? And she said, no, I haven't. I've never had a period. And I talked to the mom, and I'm like, Mom, what do you think? She's like, yeah, she hasn't had a period. We're looking out for her, whatever. And so she was very comfortable. She's never had sex. She's never had any kind of relations like that. So with the mom in the room and my attending, because I was a resident at that time, we do an exam and we see what's called an imperfect hymen. Okay, meaning the hymenal area is basically blocked off. So every time she's menstruating from here, coming out the cervix and into the vagina, which is back there, there is a wall, and that wall is blocking the blood from coming out, and the blood is getting stuck up there.
Yeah.
And the body eventually has to kind of like reabsorb it, but it's a lot of blood, and over time it builds up and it's like a big balloon ready to burst.
Yeah.
So what do we have to do in those situations?
You got to cut that bad boy.
You got to cut that bad boy and
Gotta cut it
release
open.
it, and therefore she'll be fine. It's a simple fix, right? Okay, so, and then we take her to the OR, right? And it's a very simple procedure in a
Yeah,
sense. Like
so
she gets
easy,
knocked out and
actually.
we cut, and we shoved a suction in there because we knew it was going to be a lot of
You're
stuff.
going to get hit with all this blood that's been sitting there for months, right?
It was crystal clear water,
Oh, no. What?
right? So me and the attending were like,
What?
do we just like go through her bladder?
No.
But we know our anatomy,
Yeah.
and it's no. And we took out a liter of crystal clear mucousy stuff,
What?
right? And so like, what are you thinking? Like we screwed
Cancer?
up or something? Like it's not that. It should be blood and old clot, right?
Right. It should be just blood. Brown, red, blood.
So we then like go into it, and there's a condition called mucocolpos. So she hasn't gotten her period yet, but she, like normal women, have discharge.
So all that discharge was collecting in her for months?
a liter of discharge.
So imagine that huge like Coca-Cola bottle that you have at Christmas.
And that got piled up behind. That was
Wow.
crazy.
Dude, poor thing. But
And then-
I'm sure she felt great
She saw that
afterwards.
attending for like, afterwards and whatever, and she's like, I haven't felt great since. No issues ever at all. It was just an imperfect hymen.
Wow.
It's a congenital
easy
thing. Some are-
so easy to fix.
There's a lot of congenital stuff also.
Meaning from birth, like something
right.
that you had when you were born.
And there are not enough, but there are things people call pediatric adolescent gynecologists, which is a whole other specialty,
Yeah.
and they deal with a lot of that
do
stuff.
you guys do a rotation on that or no?
Now we do.
Cool,
Now we
cool.
do.
Does every residency or no?
No, they're so rare. Don't quote me on this, but I think there's only maybe 8 or 12 or something fellowships in the country.
That's incredible.
One main one in
Wow.
Toronto, so it's
Wow.
not a lot.
That's cool though.
Not a lot. But okay, yeah. So that's some vaginal vulvar quick stuff. There's a bunch of stuff out there, but
that was my forte. I'm big on the outside of the body. Can you take us now through the other parts of lady
Sure.
anatomy?
So this is
Mostly outside the body, mostly
Right.
for fun. Party in the front, work in the back, or up in the body.
right.
Let's do it
And
that
then
way.
but very also not problematic, but stuff can go wrong post-menopause.
Yeah.
Post-menopause, this is where the exams are really important. Not that the cervix and uterus and ovary don't matter, but there's a lot of stuff that can happen here. And a visual exam is the main thing that's going to...
And again, not to interrupt you,
Go ahead.
but part of that is do not rely just on them for the visual exam.
Yeah.
You should be looking at your own business so you know what's normal and what's not.
Right. And it'll change over time, absolutely.
Yeah, but that's something that will cue you in. Suddenly things are itchy. They were never itchy. They're pale and instead of the rosy pink that you had for many years before you were menopausal.
Or also for African American Black women, we had a couple of patients that come in.
See?
It was her whole life fully black on the outside, and straight white pigmentation everywhere, and developed it's called vitiligo, just
Right.
loss of that coloration for the
just
melanin.
in her vagina, just in the
vulva.
vulva.
Absolutely, just that.
Cool.
So and that's not something you think about more in white women, but again, this is the importance of doing a training in a place that
Yeah.
has people from all over.
See,
let's just
for
say.
me, my generic is to go for my skin tone because that's my skin tone, right?
Correct.
But you're right. You have to always be thinking about inclusivity
But also
for other
big,
people.
I'm sure this is gonna hit on Instagram. Black women can get melanoma.
Oh, absolutely.
You know, we see this stuff like everywhere,
Yeah.
like as if we shouldn't just like talk about those things.
Yeah.
But like absolutely, you need skin exams. You
Yeah,
still
yeah, yeah.
have the same risk factors, and if anything, Black women have the higher chance of getting what's called a melanotic melanoma, which is the one that's without the darker pigmentation
Right.
and whatnot, which is scarier, which is more aggressive.
Yeah,
And
yeah.
I'm gonna leave that to the melanoma specialist. But basically, you need your exams
Yeah.
because we can catch things and hopefully catch them sooner rather than later. From like the real serious kind of diagnoses that make a difference in people's lives for sure. All right, so this was the outside.
Yep.
Right.
Going toward the inside.
It's going towards the inside. So let's say this was our vagina entrance, the introitus, right? And behind there is where your cervix is. And Fran was lovingly explaining how the speculum goes into the vagina right there. And we see your cervix. So take her.
Got it.
And we see your cervix. So your pap smear.
Wait, let me see if we can see this. Just make sure. Good. Show me that cervix again.
So this is a cervix
yeah,
right
man.
here.
Okay, good.
So the pap smear literally happens just right here. It's a little circular kind of motion where we take some cells off the cervix. It looks like there's a transformation zone. Take some cells off the cervix and we send it to see if there's anything abnormal on it. So this is the stuff in labor that dilates. The cervix is closed here, but it has to open to 10 centimeters, which is wild because the baby has to fit through there. The people who lose their pregnancies because of what's called a short cervix. When we talked about effacement before, this is 4 centimeters on average,
Turn it
let's just say.
sideways. Turn it sideways.
4 centimeters. Some people have a cervix that shortens and gets smaller and smaller, and therefore doesn't hold the kid up in the uterus, and therefore lets go of the baby. And you have miscarriages, sometimes even at later times, or at 20 weeks, and very preterm deliveries. So that's the cervix, small on this, but super freaking important.
Yeah, small but mighty.
Correct. So it's important about this part. This is your uterus. Everyone knows about when it comes to like cramping, bleeding, menstruation, housing a pregnancy. But uterine cancers can technically happen here, and we'll talk about that a little bit later. Your fallopian tubes. This is just like the road from your ovary where the egg pops out. So the fallopian tube is actually not connected to your ovary. This is cute, but it's not the case. So what happens is your ovary is supposed to pop every month, and the egg is released, and the edge of the fallopian tube has these little frisky hands.
Frisky hands.
And it just like sucks it in.
They're called fimbria, but frisky hands, that's
I sounded like
amazing.
you, right? Like that was good.
That was great.
That was so good.
Oh my God, frisky. I'm putting that on the shirt. That's the merch.
That's
it.
frisky hands.
hands.
Oh, that's actually pretty good. But yeah, so they actually are not connected to the ovaries, but they will pull in when the egg releases
The little eggy.
transfer it through here and come in here.
Right.
Your ectopic pregnancy is that instead of it sitting in the uterus, it's sitting in here,
Usually,
sitting on the ovary,
Yeah.
or sitting somewhere else.
Well, pop quiz. Where does conception actually happen?
In here?
No.
So the sperm and the eggs meet somewhere around here, and then together as a couple, as one.
As one. As a clump of cells that
They make their way to here.
Right.
And find a good implantation place.
Yes.
So, but they actually meet somewhere in here.
Yeah. So when you're getting pregnant, it's happening over here somewhere, and 2 or 3 days later, makes its way into here.
And hopefully it doesn't stay in here.
Correct. So that's why you get an ectopic pregnancy, usually most commonly in these areas, because that's where the conception happens. And if it gets stuck or it tries to lodge itself in somewhere along yonder, that's not compatible with a healthy pregnancy. And I need to say that louder for the people in the back and maybe in Texas. Whatever. I'm so sorry, Dan. You can edit the shit out. But the truth is that anything that's implanted anywhere except in here is automatically not compatible.
But Frank, can't I just
No.
cup? Can I just like move it?
No.
in
no,
here?
No. Can't
Why
you move
not?
your brain to your asshole? Like, no, you can't.
What if it's already in my
Okay,
ass?
well, it sounds like for some people it is, because clearly you can't. Like, if you say that, then
Yes.
you just don't know basic science, and that's what we're trying to teach.
We don't
you
have that
here.
method. And maybe one day we'll do it and it'll
Hey,
be
listen,
great.
God
like,
willing, maybe that'll come
But we
down the
don't have
line,
that.
but we don't have it right now. So any pregnancy outside the uterus is not a functional pregnancy, and I'm very sorry for those that have had that and that loss. And a lot of times they lose their tubes.
So to reconnect back to our first episode, when we talked about gonorrhea, chlamydia, sometimes you could have what's an infection in the tube from that, and it scars the tube. So imagine this is just a road, and if the road is blocked, when the sperm and the egg meet here, they cannot get past that blockage, so it gets stuck here. So that's where the rates of ectopic or just infertility, because if the egg can't get past that blockage and the sperm can't get past that blockage, you'll never get pregnant.
They'll never meet.
From this
They'll
side.
never have that meet cute.
Right. So that's why this road is super important, but it's actually also pretty fragile in the sense of a lot of stuff can go wrong with the bringing infertility or high risk of ectopic pregnancies, and so on and so forth. And then comes your ovary, right? So your ovary, one of your questions there, but I'm just gonna skip to it, is that what body part I hate the most when the female reproductive system is the ovaries. And my opinion is even though they do so much great, they are one of the worst cancers to have. And there's no effective way to screen for ovarian cancer. Usually once we know, it's already too late. And even though our oncologists are phenomenal and they're doing a lot of research to figuring out what we can do in the future to either screen for it or treat better, the outcomes generally aren't so good. So
how do you, why would you, as a GYN, why would you look for ovarian cancer? What would trigger you if someone came into the office that would make you want to look for ovarian cancer?
What does it mean to look for, right? So
exactly.
So when we screen with a PAP, right? Someone's like, well, you're doing a PAP. Don't you know if I have ovarian cancer or uterine cancer? No, because look at this. I'm just getting cells from literally this little edge. No clue. No, they're not giving me any signals to over here. We do an exam, it's called a bimanual exam, where and this is uncomfortable, but we put our hand in the vagina to feel and press on the belly to feel the uterus. Literally, my hand is on the cervix from in the vagina and from the belly up above to feel the size. And at the point that we feel a mass in here, that means the ovary is already huge, probably metastasized to the cavity, on the bowel, the bladder, and all that stuff, and you're already distended. So by that point, it's already too late. But how do you screen for ovarian cancer? There is no way.
That's horrifying.
Even if you do a sonogram once a year, right? That's always a question I get. Hey, let's do a sonogram once a year just to make sure I don't have any other cancer. I'm like, sure, maybe we could catch something, but you could have a scan today, 3 months later, have stage 3 ovarian cancer.
Seriously?
Yeah. It is very rapidly progressive.
That's horrifying.
I've had people, and also in the setting of
So why don't we just take them out? Prophylactically, let's just take the ovaries out once we're done with menopause.
I mean, let's take out the appendix, let's take out the gallbladder, let's take out half our livers just to have a less chance, maybe one lung too. I think you go down a slippery road. But also, a lot of this perimenopause talk that we have nowadays, you take out the ovaries, you lose your hormones.
Right.
And the hormones have, let's pretend we're not talking about perimenopause symptoms. They have great still support for your bones,
your heart,
and for your heart.
Your heart.
And for your brain a little too. When it comes to Alzheimer's and just cognitive function, even though that's not as talked about as much. But let's say your bone and heart, which is a solid fact.
Yeah, I'd like my bones and heart to stay healthy.
And the number one killer for women is heart disease. Mm-hmm. So if you don't need, it's like a catch-22. Sure, let's take out your ovaries, and then you have heart issues, let's say long-term or whatever.
But meanwhile, you would have never had a problem with your ovaries, but now you got a problem with your heart.
Right. So, I mean,
there's no right way.
There's no right way. And we're doing research. We're doing research. The GYN oncologists who are...
I'm not doing any research.
I'm doing a podcast.
I watched the research happen.
I'm doing a podcast, and I'm just sharing with you guys. But we obviously know of them, and the oncologists are fantastic all over the country, so God bless you all.
Yeah, man.
Or whatever, bless you all, because hopefully one day there is a way. There is a way. But yeah, so that's why I hate the ovaries.
Okay, that's fair. That's fair. All right, well, we're going to take a 2-second break, and then we're going to jump back in, and we're going to start going into our myth busting.
See you soon. All right, guys, thank you all for watching the most recent episode of No Shame OBGYN Podcast.
Be sure to like and subscribe and share with your friends.
That's right. We'll be back.